Saune Jai Shri Krishna, Jai Jinendra, Jai Swami Narayan, Sairam, and good afternoon, good evening to you all. It's all over the world now, aren't we? Um, so, your eyes are the windows of your world. Caring for them is caring for well being. GAA London is pleased to host an insightful community health webinar dedicated to eye care and eye health. Join us as we learn how to protect, preserve, and improve our vision with expert guidance. Our distinguished guest speaker is Anand Vyas, optometry and neuroscience from Manchester University. He's learned quite a lot from there. Brings over 25 years of experience in eye health and will share practical knowledge on common conditions such as cataracts, glaucoma, diabetes related eye issues, dry eyes, and muscular degenerations. So, this session will help you understand causes and risks of common eye conditions, explore preventions and management strategies, discover the latest treatment options available, engage in an interactive Q&A for your eye health concerns. So in the chat, while we are going through, in the chat, please put your questions there so you don't forget, and then we can follow it up as we go along. So let's come together for this information and interactive evening to learn how to keep our vision strong and healthy for years to come. So sorry about that. I do apologize. Can we please mute everybody as you log in? Mute yourself.
Mute.
Can I invite Anandji? All yours, Anandji. Welcome back.
Thank you, Panavan. First of all, namaste and thank all of you for joining us today. It's wonderful to be having this opportunity. Also, a special thank you to Kamlesh D. Vara, Panavan yourself, and all of the GAA committee as well, because without all of your efforts and hard work, none of this would be possible too. Now, I understand that for most of us today, I'm standing in between you and a nice dinner this evening. So without further ado, we'll get cracking on. Let me just try and share my slides. Okay, hopefully you can see my slides over here.
Yes.
Great.
If you can just view it.
Is that better now?
Yeah, that's better.
Brilliant. So as Panaben mentioned, I'd just like to go through some of the common eye conditions which we'll present, which may be affecting some of you and or your loved ones as well. And I'm going to tackle this from the position of the questions which we get asked in practice, the common questions for cataracts, glaucoma, diabetes, etc. So we'll touch upon all of these, and then later on, if you have any questions, or if you'd like me to go into further detail, then we'll have time to do so as well. So to start with, how many of you have had an eye test in the last few years? Have a think about this. I don't know if it's possible to organize a poll here, but just have a think. Have you had an eye test in the last year? Has it been just over a year? Have you not been for several years? Or do you not know what I'm talking about? You've never had an eye test. Hopefully it's somewhere near the top, but I'll try and convince you as to why that should be the case as well. So the first condition that I wanted to speak to you about today is cataracts. Now, a lot of people feel or think that a cataract is something which grows over your eye. So it's like a film which grows over the eye, which stops you from seeing. And that's not quite the case. So the eye itself, you'll see from the diagram of the eye there, the eye is quite like a camera, or the olden day cameras that we had. Let's just go back to the poll. If you can just finish that poll, that's it. How many of you have had an eye test? Brilliant. Excellent. So I think my job's done. We don't really need this talk. I think you're all up to date with your eye care. That's good. Okay, fantastic. So let's carry on. So when we have a cataract, then it affects the lens, which is at the front of the eye. You can see that white circular mass there at the front, which is the lens. And effectively, that lens becomes cloudy. And it's very common, and pretty much I think everybody will develop a cataract. The question is, do we need to have it removed? Is it really causing us much of an issue? So what are the common reasons why a cataract exists? The first one is quite commonly age, generally from the age of 50, but commonly post 70, cataracts will start to form and will start to cause some sort of concern. There can be reasons why this is speeded up. For example, medication which you're taking, especially any steroidal medication, UV exposure. So if you are in countries, for example, like India, in the UK where there's high UV and you're not protecting your eyes for UV, then that can increase or speed up the progress of cataracts too. Malnutrition, not as common in this country now, thankfully, but that could be a reason. And general health as well, either genetics or smoking. So let's just try this poll again. Do you know anybody that's had a cataract or had cataract surgery?
Yes.
So what actually happens when we have cataract then? Let's go to poll number 2. Good. So quite a few of you actually have had or know of people who've had a cataract. So that's quite interesting. So when you have a cataract, your vision becomes blurry. You have less vision. Your contrast fades as well. So the brightness of colors will reduce too. When you are driving, especially at night, you may find that you're getting extra glare, which can be another problem. And potentially in low lighting conditions, your vision may be more affected. Sometimes around bright lights, like I said, with driving, you get the glare and halos too. And also your prescription can change. So maybe rather than having a change in prescription every, say, 2 to 3 years, it could be every 6 months to a year. So how do we manage a cataract then? The good news is there isn't really always much we need to do for a cataract. There is no pain with a cataract, and whether you have an operation or not really depends on yourself. At an early stage, we would just update glasses and make sure that your vision is as clear as possible for whichever tasks that you want to carry out. So that could be driving, TV, it could be reading, you could be using computers and need to see at that specific distance. So updating your prescription and making sure you've got the right protection from light is the best thing. If that fails and your vision is still not good enough, then we move on to surgery as well. So the lens is removed from the eye. You can see at the front this white S type of shape device, which is implanted into the front of the eye. That's called an intraocular lens, and that will now give you clear vision. Most of the time, your spectacle prescription will also be included into that lens, so the need for glasses reduces too. There are companies who are trialing drops to see whether the medication can be used to dissolve cataracts so that you don't actually need an operation. But a lot of that is still in the early days. So hopefully in the next few years, we'll learn more about that too. Now, the main question is, and this is what we get asked a lot, do I need to have an operation? And as I said before, it's really up to you. This is the test chart that you might be familiar with at the opticians. You can see the line at the bottom, which I've highlighted with the red markers, the red line either side. That line indicates 6/6 or 20/20 vision. Okay. If you're unable to read the lines which is higher up, with indicated by the double dash lines, then that means that your vision is not safe enough for driving. And at this point, you're probably going to have other issues. For example, subtitles on the TV screen may be a little bit more blurry. And also when you're reading, say, for example, newspaper size print, small print, would probably become difficult too. So at that level, the NHS would be happy to operate on your eyes. Now, it could be that your vision is quite close to 6/6 or close to 100% vision, but it's still affecting your lifestyle. You're not able to carry out the tasks which you need to, either for work or for your hobbies, confidently. And that could be a reason why you may have a cataract operation earlier. On the other hand, you may be housebound or you may not drive, and you may be happy with your level of vision. And then if you're not really keen on having an operation, then no surgeon will really force you in order to have that done. So whether or not you need to have a cataract operation really just depends on your circumstance. And in this country, at least, even if you wait a little while extra, the chances are it's not really going to have a long-term effect on the overall health of your eyes. So it's always a good conversation to be had with your optometrist. Keep them updated and try not to ask them to refer you to the consultant at the hospital. And then when you get in front of the consultant, then you say, well, actually, I don't really need to have an eye test. That conversation can be had with your optometrist, and then the referral will only take place when you actually would like to proceed with that. So that's cataracts. Age-related macular degeneration. This is probably the highest cause of sight loss, vision loss within the Western world. Effectively, what happens is the macula, which is the central part of your vision, that starts to degenerate. And there's two reasons why this can happen. With dry AMD or dry macular degeneration, you have changes which do not, obviously, as the name suggests, which are dry changes. So it's the tissue which is just degenerating slowly. With wet macular degeneration, there is a leakage of fluid. So it could be that there are hemorrhages from the blood vessels, or it could be that there's some actual liquid which seeps in between the layers of the retina and therefore distorts the retina itself. So with macular degeneration, the dry macular degeneration first, that is a slow progressing condition. It could take many years for you to actually notice any changes. And those changes would take place over years, as opposed to with wet macular degeneration, days. With wet macular degeneration, the blood vessels can change. They can burst very, very quickly. So literally overnight, your vision could change and you could have some form of sight loss. So if that was the case, you would know that you would experience that vision loss straight away, immediately. So what are the risk factors for macular degeneration? Generally speaking, again, it affects the elderly more, so over the age of about 60 to 70. If you smoke in general, then that really has a very negative effect on your eyes. So we'll speak about glaucoma. We're looking at age-related macular degeneration, cataracts. All of the eye conditions can be speeded up effectively because of the effects of smoking. UV exposure, again, is one other issue, like with cataracts, which can affect your eyes. And also any family history increases your risk. We will talk about poor diet in the second, but this is a good example of how a lack of vitamins and minerals can affect your eyes. So, how would you know whether or not you actually did have macular degeneration? Okay, I admit you probably wouldn't unless you go to see the optometrist, but it affects your central vision, which means that anything that you look at will appear either distorted and out of shape or just blurred where you can't really see anything. You may still be able to see from the side or the corner of your eyes. So the good thing about macular degeneration is that yes, it affects the central circuit or the central your central vision, but you won't become totally blind because you will still have your peripheral vision. Okay. If you notice any distorted vision, and what I mean by this is some people say that they're looking out the window and the lines appear wavy rather than straight, so the window lines, or you're looking at the door frame and it's appearing distorted as opposed to straight. The same thing can happen when you're looking at your phone or you're trying to read as well. So any distortion in your vision, that's something which needs to be checked out as soon as possible. I would say immediately. Try not to wait a few days or weeks for that to resolve because it could be too late. So any distorted vision, you go straight to your optometrist, or if not possible for any reason, you can think about going to the emergency eye hospital. With dry macular degeneration, there's no actual common treatment for this at the moment. And a lot of people advocate the use of vitamins and minerals to increase the strength of your eye, if you like. So there are vitamin tablets which will target your eyes and target the macula. They have lutein, zeaxanthin, mesozeaxanthin, and other vitamins too. And this can help to slow down the dry macular degenerative changes. There is over the last year or so, red light therapy has been used. So you may have come across this photobiomodulation, it's called, where red light is used to treat various conditions in the body. And there is a treatment available for dry macular degeneration, and this is privately using that red light therapy. Other than that, the vitamin tablets are the best weapon, if you like, to try and fight this. With wet macular degeneration, injections are given into the eyes to try and effectively dry the eye out so that the fluid which is there is removed by the body and the eye becomes dry. And although wet macular degeneration is the more severe and can cause the higher level of sight loss, with the injections, generally speaking, with the majority of people, your vision can be restored to a very good level. So if you're worried about macular degeneration, or if somebody very close to you has this, what should you do? First thing, regular eye tests, potentially with OCT scans, which is almost like an MRI type scan of the eye. That's very good. And if you have that regularly, then any small changes in your eyes can be picked up very quickly. If you know anybody that does have macular degeneration and they are struggling with their eyes, low visual aids, so magnifying glasses, telescopes, various changes which can be made inside the house as well, increased lighting, all of these things can help to help them to use their potential vision or whatever small vision that they have so that they can still be independent. So tell me, do you know anybody that uses low vision aids? Magnifying glasses, telescopes, they've had extra lighting put in around the home, or they're using large cards, anything like that. I'm not sure where the poll's gone on my end, but if you have that, then you can have a look. Okay, we'll come back to that. But just bear in mind that if you do know anybody who is suffering with their vision, then low visual aids can be used to just help them use whatever sight that they have. Okay, we'll move on quickly to glaucoma. It's called the silent thief of sight, and the main reason is because for the majority of people, for 90%, if not more, the glaucoma itself will be painless, and you won't know that it's there. It's generally found during an eye examination, and there are two types of glaucoma that you could have. One is open angle, and the second one is angle closure. Now, what this actually means is, in general, with glaucoma, the pressure in the eye increases. The reason why the pressure inside the eye increases is because there is a fluid that circulates around the front of the eye. And either because there's too much of this fluid which is being produced by the body, or because the drainage of that fluid is less, i.e., it's blocked, the amount of that fluid builds up. The pressure inside the eye pushes backwards, and it starts obviously to affect the more fragile parts, which is the optic nerve. So as the optic nerve absorbs that pressure, the nerve fibers start to get cut off. They start to degenerate, and then you would lose your peripheral vision. So with macular degeneration, we spoke about your central vision being affected and you not being able to see in front of you, but you can see from the side. With glaucoma, your peripheral vision will go, and you can get tunnel vision, where you can only see directly in front of you and not from the side. So with open angle glaucoma, or depending on the type of glaucoma that you have, that would then affect the way that glaucoma is managed. Okay, your pressure would have to be extremely high. You can, if there is angle closure glaucoma, then that can affect you very, very quickly. That is extremely painful, becomes a medical emergency. Hundreds of years ago, when people had this angle closure, the pain was so excruciating that they felt that it was something like appendicitis. Luckily, we don't make that mistake now. But angle closure is actually happens very, very suddenly. You'd have probably a red eye. It'd be excruciating pain. With the open angle type of glaucoma, the only way to really know that it's present is to test for it. And that's why whenever you go for your eye examinations, the optometrist will be checking for these as standard. Do you know anybody that has glaucoma? Now, this is a really important question. And the reason is, if you are over the age of 40 and you have a first degree family member, so either your parents, your siblings, or your children that have glaucoma, then you should be having an eye test every 12 months. Your prescription may not change for 2 to 3 years, but it's important that you have an annual eye test. And the reason for that is because if there are any changes in your eyes, because of the family link, we would be more overcautious, and we would want to test for that to make sure that you do not develop glaucoma. Glaucoma in general is a very slow progressing condition. So if it's picked up early enough, then we can make sure that it doesn't affect your eyes and it doesn't lead to sight loss. So again, if you're unsure whether or not any of your family are taking or have glaucoma, ask them obviously ask them the question, they'll probably be able to tell you directly. But if you feel that somebody's taking drops on a regular basis, there's two reasons why they'd probably be taking drops. One is they have dry eyes, and the second one is that they have a glaucoma and they're taking drops regularly. So it's always a good one for everybody to know about. So as I said, you can see in this picture here, you get tunnel vision, you sight loss from the side, and then your vision remains here. You'd have to, hopefully this wouldn't happen, and it has to become very advanced for you to have vision at this stage. When you have your eye test, the pressure will be checked, the visual field will be checked, And then the OCT scans and imaging can also aid in just making sure that we follow any changes or subtle changes in the optic nerve. So the key takeaway message here is regular eye examinations, stay healthy, exercise, and obviously you've guessed it, don't smoke. Moving on quickly to diabetes and your eyes. Now, this is probably quite a common one. In the UK, there are just under 5 million people with diabetes, and there are certain communities, such as ours, who are affected more. And what we think is that 1 in 3 people will develop some form of retinopathy. So what is retinopathy? How does diabetes affect your eyes? The main way that this happens is that your blood vessels develop tiny gaps in them, and your blood vessels start to leak. So think about your garden hose. You connect it to the tap, you turn it on, and you're hoping that the water comes out at the end. But if you have holes in the hose, then you have water squirting out here, there, and everywhere. That's similar to what happens to the blood vessels in your eyes. And obviously, if it's happening in your eyes, then rest assured it's happening elsewhere in your body too. So as the blood leaks out, there can be a lack of blood getting to the extremities or the extreme areas of the retina in your eyes. And therefore, there's a lack of oxygen which gets into these parts too. So the lack of oxygen is the main trigger, the main factor, the main problem. The second thing is that as fluid leaks from your blood vessels, it causes other issues as well. So lack of oxygen causes retinopathy, but diabetes also causes other eye conditions as well. So it will increase the likelihood of cataracts. It can cause glaucoma. It can cause retinal detachment and various other issues too. There are different stages of diabetic retinopathy. So and when you go for your screening, if you've ever been, hopefully you'd go every 12 months. But you may get a letter back which says there are background tiny changes at the moment and we're not too concerned about it. Control your blood sugar levels. You could have maculopathy, which is the more serious type, which is affecting your central vision. So what does all of this mean? Well, at an early stage, the blood vessel just starts to bulge slightly. You may have some hemorrhages, but they're little, very, very tiny drops of blood. And in a lot of cases, the body may be able to absorb those and move forward and to deal with it itself. When that becomes more advanced and there's more damage to the blood vessels, then you get the uncontrollable leakages, you get lipid deposits, you get various other fluid which is leaking out from the blood vessels. And that then causes a lot of problems for your vision. So what can you do if you have diabetes? The first thing is to make sure that your blood sugar is in good control. And if your blood sugar level is high, then dropping your blood sugar level very rapidly is also not good too. So you have to make sure that it gently reduces to a good level and that you maintain that level rather than having extra fluctuation, because it's that extra fluctuation which can bring about the retinopathy. So that's one thing. If there is a lot of fluid leaking and hemorrhages, then that can then you may need injections in the eyes, as you would have with macular degeneration that we discussed before. And the injections would help to dry out your eyes effectively. Worst case, if there is very advanced diabetes, then it could be that you need laser treatment. And effectively, what the laser treatment does is burn out parts of your retina so that there is no need for the blood to travel there and the oxygen to be supplied there. So that is a more extreme type of treatment for diabetes. There's something which I came across recently, which is this eye mask from a company called Noctura, and they work slightly differently. So remember we said with diabetes, it's the the necessity for oxygen and the low supply of oxygen, which causes all of these changes. The supply of oxygen or the demand for oxygen increases at night when we're sleeping. And with this mask, what you can do is wear it at night while you're sleeping. It has a very, very mild green light, and that fools your eyes into thinking that it's not quite nighttime, and therefore reduces your oxygen demand. So this is potentially an alternative which is proven to be able to reverse some of the effects of diabetic retinopathy. So just very quickly then, what can we do to take care of our eyes to make sure they outlast us? At the foundation of this, I would say regular eye examinations is necessary. Your eyes, your prescription rather, will probably change every 2.5 to 3 years. But having an eye test at least every 2 years, potentially even sooner than that, depending on what the situation of your eyes is a good idea. Have a good relationship with your optometrist so they understand your eyes. And if you're not sure about what's happening, I always tell my patients, be overcautious, because changes inside the eye may not lead to pain. Sometimes we notice changes, but what we do is we wait until it resolves itself or wait until it gets better. But if there are eye conditions or if you have any changes inside the eye, treatment needs to be given as soon as possible. So have some sort of relationship where you're happy, your optometrist is happy just to for you to book an appointment, or you can call them and discuss any issues that you're having and then discuss the best way for that to be managed. Make sure that lighting is good too. By the time that we reach the age of 80, we will need 4 times as much light as when we were 20. Okay, so that also means that by the time you're 40, you need twice as much as when you were 22. So make sure lighting is good. Make sure that around your house, especially near the stairs and the sort of hallway type of area, the lighting is good and there are no rugs, so that you reduce the chance of yourself or any elderly people who may trip up and fall over there too. Obviously, lighting is good when you're working or if you're using a computer. Make sure that the room lighting, your desk lighting, and also the lighting from your display unit as well is all in sync and it's bright enough. Not too bright, which causes you glare, but not too low either, which causes you strain. When you go out, use sunglasses to obviously protect your eyes from glare, but also from UV too. And if your prescription changes, then update your glasses so that you're not walking around or driving with glasses which are not suitable. A few good things. With macular degeneration, I touched upon the need for vitamins and minerals. So what is it that you can do now? Do you need to wait for you to have macular degeneration before you take the tablets, or should you take them now? There are 3 or 4 food groups which are good for your eyes. The first is green leafy vegetables. So they are your spinach, your broccoli, your Brussels sprouts, cabbage. They have the right types of vitamins which your eyes need to function. The second one is bright colored fruits and vegetables. So your yellow capsicum, red capsicum, mangoes, papayas, strawberry, they are very good for your eyes as well. It's not only just carrots. Omega-6 and omega-3 oils are very good for your eyes, and especially your tear formation. And also a good level of water or hydration is very, very good for your eyes too. So eating the right foods, drinking water, of course, avoiding smoking, using the right prescription and glasses that you need, and having the right lighting are the main things that you need to. And underlying all of that is regular eye tests too. You see at the top here, it says about the 2020 rule. Sometimes people get eye strain when they're using computer. And the more that we've been using computers, the more effect it has on our eye, especially when we're working from home. So the 2020 rule is a good way to try and reduce this. So what you do is every 20 minutes that you're looking close within arm's distance, so you could be reading, you could be using the computer or your iPad, use your iPad for 20 minutes, and then for 20 seconds, you look as far away as possible outside the window, 20 feet or even more. And the reason for that is the further away you look, the more of a rest the muscles get, which are controlling your eyes. So that way you avoid undue eye strain. So, any questions, anything else that you'd like me to discuss or go into more detail about?
Hi, Anand, it's Kamlesh here. So look, I'm gonna moderate the questions for you because there's lots coming in on the chat. But I've got a question which is a general question that I get asked. And I want to relay that to you, which is eye tests. Are they available on the NHS and for free when they come to when senior people come to an optician's?
Yes, they are. They're let me qualify this. If you're over the age of 60, then you are entitled to a NHS eye test every 2 years. If your optometrist sees you and feels that you need to have an eye test in 12 months or 6 months or before those 2 years, then that's allowable as well. And in the meantime, if you feel that your vision has changed and you would need or you want an eye test sooner, then you can have an eye test earlier. However, what's not allowed is for you to have a 12-month eye test just because you're 70 or just because you're 80. Okay, so that's the first thing. Now, when you have an eye examination, your general eye test will be covered. So your glaucoma checks, the health of your eyes, your prescription checks. But there is other equipment which is available, which is not part of the standard NHS eye test. So having a photograph of your eye, having scans of your eyes, if you have, for example, dry eyes or any other conditions which need other tests, other investigation, again, that might not be covered by the remit of the NHS eye test, and they would be charged for privately.
Okay. And I mean, your advice to sort of go for the slightly more extensive test, especially as people are aging, so that they get the benefit of all the expertise and all the assessment?
There's two reasons why I would suggest that. First of all, your eyes may be fine, your eyes may be 100%, but if you have the other scans and equipment done, then it gives us some background data, number one. Secondly, sometimes like the OCT machines, they can pick up detail which would be hard for us to see with the naked eye. So for that change to develop and become visible to me with my lens and my slit lamp could take 2 to 3 years. Whereas the machine would be able to tell us immediately if there's like a micrometer change in any of the tissues there. So I think it's always worthwhile having as much information as we can and then deciding whether we act on that or we just manage that.
That's brilliant. So what was interesting to me, we ran a poll and the poll sort of went and didn't go. But one of the questions that we asked was, what do people think about glaucoma, and did they know that there's no symptoms with glaucoma? And what was interesting to me was that 40% didn't know that there are no symptoms. So it's the silent thief of sight, right? But 40% did not know that, which I found quite a high percentage that didn't know that, and hence even more important to come into a specialist and an expert to have your eyes tested, because this could be going on in the background and you're not knowing, what the issues are.
Right. I attended a medical camp in Malawi, and we had a man who rode a bike with his daughter, and they came to see us from Mozambique. They traveled to Malawi, and what had happened is that the father had macular degeneration, so he didn't have any central vision. Okay, he had peripheral vision. The daughter, at the age of 12, had glaucoma, and she had tunnel vision. So she only had literally this much vision. She couldn't see anything outside of what would have been directly in front of her face. So she was sat on the handlebars, and the dad was using his peripheral vision to ride the bike, and she was navigating directly in front. And they traveled for miles and miles so that they can see us and get an opinion on their eyes. And it really struck me because there's a girl at the age of, say, 12, 13. She had advanced glaucoma. And I've never seen that before. I've never seen that in this country. And one of the reasons why that's the case is because we have such good equipment which is available. Fine, sometimes you may have to spend 20, 30 pounds to avail that. But in general, even if we don't do that, we have such good equipment, we have such good expertise which can pick up something like glaucoma very, very quickly. And if you follow the right channels, it won't interfere with your lifestyle or with your vision. So it's always a shame when people either ignore their eyes or they don't just avail of that regular eye test. And if you have a family member who has glaucoma, then I, as a practitioner, would be extra cautious. If I'm not sure about whether those changes in your eyes are related to glaucoma or not, if your father has glaucoma, your mother has glaucoma, I would just investigate just to be sure that that wasn't the case.
Okay. So sticking to the subject of glaucoma, a question that's been raised by Jag is, how do you know that glaucoma is under control? Is there a way of knowing this?
There's the two main ways. Number one would be the pressure in your eye. So we would want the pressure to be as low as possible. However, you can also have low pressure glaucoma. And when you have low pressure glaucoma, what we think is there's probably a reduction in the blood flow at the back of your eye where the optic nerve is. So the best way to monitor for glaucoma is to have a visual field test to actually test your peripheral vision and to see how well it's working. So what I mean by this is when we have an eye test, you have a test chart in front of you, and you're asked to try and identify the lowest letter, the smallest letter that you can see in front of you. But what we don't do is check to see through that vision test how well you can see in the periphery. Well, a visual field test would do that. And that's a good way of then being able to monitor for glaucoma.
Brilliant. So we've got a question directly from Nima. Is it Nima Sururu? Would you like? Yeah, there you go. Thumbs up. Do you want to go ahead and just unmute your laptop and ask your question? Thank you.
Thank you so much, Anand. Very informative. And it's my husband who has lost his vision, and he has in the left eye, isn't it? Optic nerve damage. So, is there any treatment for optic nerve damage? Even he can get back a little vision, because right eye vision is totally gone in 2006 in an accident. Also, he lost iris as well at the same time in the accident. But this was 15% vision he had, but during the lockdown, there was no monitoring from Moorfield Eye Hospital because all the hospital had cancelled all the appointments everywhere. So we don't blame them. But then when he started seeing nothing, then we thought it's something wrong with the left eye, because anyway, right eye didn't have vision at all. But then when they checked it, they said your optic nerve is damaged.
With nerves, it's very, very difficult for nerves in our central nervous system to regenerate. And that is the main cause, or that's the main reason why it's difficult to give any medication at the moment. So there's lots of trials which are going on, even stem cell replacement, etc., to see if we can develop any treatment which effectively regenerates the optic nerve. So I think you mentioned that your husband's iris is damaged as well.
On the right eye. This is left eye optic nerve damage. But
Okay.
on the right eye, he had an accident and he lost his vision and also the iris as well. So he couldn't take the light at all now.
Okay, so I've had patients before who have been in a similar situation, and what we've been able to do, even 30, 40 years after they've had the accident, is to work on the iris, remove the cataract so that they have some sight. So it's obviously difficult for me to say specifically for your husband without not knowing the actual case. If there is nerve damage behind that, then it's very difficult for any medication to reverse that nerve damage. But if the nerve in the right eye is still intact, then it could still be possible to change the iris or to use contact lenses or to manage the light in some way to bring back vision to a comfortable level.
Yes, thank you. He is under the Moorfield Eye Hospital since 2006.
Sure.
So in 2006, every week the ambulance was coming to take him when he lost his iris, and they were doing study case as well.
Yeah.
But then gradually now it's every 2-3 months, and last year in 7 months he had 4 times. Is it 4 times? Because of his eye pressure, which eye is it? I forgot. Is it eye pressure and which eye it is? Right one. Right one. So it's still now he had a fall, very bad fall, and he was in the hospital, then care home, and this for the high eye pressure is being given this is called lotiacrine. I don't know how to spell. It's LOTACRYN.
So it sounds like your husband is already under really good eye care. And I think he's, in that sense, he sounds like he's in a very good place. I mentioned low visual aids before, and that's something which, if you haven't had access to, then just try and ask the hospital to arrange a low vision appointment so that the eyes can be assessed to see if there's any other products which can help to mobilize or to use the remaining vision.
Because now he can't go to, because he's not mobile at the moment. He's homebound now. So it's difficult to go to Moorfield Eye Hospital. I rang them and I said this was given after the operation, and now it's now nearly 2 months now he's back from the care home. So how long he has to continue this?
Well, I think it's a little bit difficult, but maybe if you contact me directly, I could maybe understand a little bit more, and then we can discuss it in more detail. But it sounds like it's possibly a little bit more of a complex case.
Okay, thank you so much, Anand.
All
Thank you for your time, and I will take
Please do get in touch.
Time. Thank you.
Yeah.
God bless you. Thank you.
Thank you.
And look, can I just say to people, clearly everyone's got different circumstances, and so this session is really about general understanding of eye care. So if you have personal questions directed, as Anand said, please reach out to him separately, because there's lots of questions being asked, and we sort of want to tackle as many as we can today. So I want to tackle some of the easy ones, and if that's possible. This eye mask that shines the green light, fantastic. Where do we get it from?
It can be ordered online directly with the company, or even through some optometrists who are working with the company as well. If anybody's interested, you need to have some scans done of the eyes to monitor what level it's at, and then I would normally then tell my patients whether it's worthwhile going for, and then you would the mask is replaced every 3 months, and you have to wear it every night while you're sleeping. But we do a combination of the company monitors your usage and the effectivity of the mask, and they program it slightly as well. And then I would normally do the scans for that and monitor to see the actual effect that it's having inside your eyes.
What is the proper cost of that?
Do we have to go through it to the eye optician to have the mask?
You can also order directly from the company as well. However, you also need to make sure that there is somebody monitoring your eyes, and you're also having the scans to see if there's actual change and there's improvement as well.
It's just because I've got retinopathy problem, but nothing to be done at this time. Every year they keep on saying that. So I was
Yeah.
listening to you, wondering that wearing that mask can help me as well.
Yeah. So the cases, the studies show that if you start early now, then it just helps the body to control the issue and to recover so that it doesn't progress later on. Effectively, when you get to the stage of laser treatment, it's not really a treatment. Effectively, what's happening is that the laser is burning off your retina so that it's not in use and therefore it doesn't need blood. So the argument from the company is, well, if we can reverse that at an earlier stage, get everything in good control, then it saves you having that issue later on.
Okay. So it is a particular company where we have to go through. Yeah.
Yeah. So
I could put it on the chat.
Yeah, I can do. It's called Noctura, Noctura. That's the name of the company. And you can just, if you go online, then you can order it directly from them too.
Okay, thank you.
Typically,
it costs something. I'm not sure exactly. It costs roughly about £80 every month. And
okay,
they
and you have to change it every
3 months. They give you a new one. Yeah, yeah.
Right. Okay. Thank you.
and sticking on the subject of diabetes, I mean, a question was asked here by Banu. Are you prone to get a cataract if you're type 2 diabetic?
It increases the chances of you having a cataract, but it doesn't necessarily mean that you're going to have it super early. If you have diabetes or pre-diabetes and your blood sugar levels are very, very well controlled, then you can go years and years without having any effects on your eyes. If you have diabetes for a very short period and your blood sugar levels are extremely out of control and fluctuating highly, that's when you can have diabetic retinopathy even very quickly within months or years. Sometimes patients come to us, we will carry out an eye examination, we'll find changes which suggest diabetes, and then ask them to go to see their GP to have that investigated further. So it all comes down to the control of the blood sugar levels.
So I'm going to go to Banu in a minute, who's raised her hand. But Banu also asked one other question, and I hope I pronounced it correctly. She's asked, can you please explain what is cornea guttata or guttata?
Can't see it on here, but
it's further up. It's came in at 648.
okay. So generally speaking, that affects the health of your cornea. And if you imagine that the cornea is like a clear window or a window pane, which is 100% clear. When you have guttata, then you have changes in that. You have small bumps, so it becomes slightly irregular. Now, what happens is as the light goes through and hits those bumps, it scatters, and therefore your vision is not clear. So rather than being like a clean window, it's like having water droplets on that pane of glass. So when you look through it, it's not 100% clear.
Great. Let's come to Banu. You got your hand up.
I sure did. I know you've talked quite a lot about diabetes and how does diabetes affect the eyes and what can be done to prevent damage. But I would like to know I'm not sure whether I'm saying it right as well, myopia in children be slowed down.
Okay. Myopia is...
myopia.
Yeah, myopia is short-sightedness. And generally speaking, if your short-sightedness can start at a very young age, it increases until your, say, 20s, and then 20s to 30, not much age. After the age of 40, everybody becomes long-sighted, so then your short-sightedness starts to improve a little bit. What's been happening very recently is that the incidence of myopia or short-sightedness has been increasing. So especially if you go to the Far East, you will see in certain age groups classrooms of children who are now short-sighted and wear glasses. So 20, 30 years ago, it was less common to see people with glasses, or the majority of children did not wear glasses. Now, in certain countries, especially, the majority of children are actually wearing glasses. So myopia management is a technique, if you like, of using different optical solutions to try and control myopia or short-sightedness, so that rather than it increasing and the power of the glasses becoming very, very strong and high, we can try and control that so that the prescription stays low. But it's worthwhile doing. If anybody has short-sightedness, or if there's a child who has short-sightedness, then it's definitely something which should be looked at.
My grandson, he's only 7, and he's got this, and it is very difficult. So, what steps can we take daily to protect our eyesight as we age?
Okay, so for your son and for children in general, daylight exposure is very important. So spending 2 to 3 hours outside in direct sunlight. So that doesn't mean just in the car or, I don't know, inside a gym or inside a school classroom, but actually direct sunlight, daylight exposure is very important. So for children, and especially myopia, that's the first thing. As we age, 2 or 3 things. Don't unnecessarily strain your eyes. You'll never go blind or lose your sight because you're straining your eyes, but it does become a little bit more uncomfortable. So always keep your eyes relaxed, whether that's by using more lighting or by using the correct glasses. The second thing is make sure that you control what you eat in terms of having the right types of vitamins, minerals, nutrients, and having water too, because that helps either the tissue to stay strong or your tears to function properly as well.
Thank you, Anand. That's wonderful to know about it. Kamlesh?
Thanks. So look, common question. I have floaters. What causes them? What can I do about them?
So float inside the middle of inside your eye. Hold on a second. I have my friend. So if we were to open up your eye, then there would be this bag of jelly in the middle. Okay, that's called the vitreous. So when there are changes in this bag of jelly, the vitreous, that's when we develop floaters. So what commonly happens is that jelly substance starts to condense slightly, and that condensation causes slightly watering of that jelly, and that's when these opacities, the vitreous opacities, form, and they cast shadows on the back of the eyes, and that's what floaters are. They can occur from any age. I think I was probably around about 17, 18 and should have been revising for my A-levels and noticed that actually when I look up into the sky, there's floaters. So they can happen at any age. Generally, with age, they would happen more. Depending on your prescription, they can happen more too. And they can be more severe. If you have floaters, the first thing to do is have an eye examination so we can try and work out where they have come from. Is it generally because of a change in the vitreous, or is it because there's something else which has happened? If you're noticing flashing lights, then you need to have that checked urgently as well. So as this bag of jelly, as it sort of pulls on the retina, that pulling, that traction will cause a flashing light to occur. And normally you notice that at night or when the lighting level, the lights are off or the light is low. And if you're getting the flashing lights, or if you've just had flashing lights and then you're getting floaters, that needs a lot of investigation too. So in general, if you have floaters, have an eye examination. Let's see where that's going from. There are some vitamin tablets that you can get which can sometimes help to thicken up that vitreous so that the floaters disappear. I think it's potentially about minimum 50% effective. And worst case scenario, if the floaters are just all over your eye and in the middle of your line of sight and you're really struggling to see, there is some other sort of procedures which can be carried out as well. But it needs to be quite severe and frustrating for you to go through that.
I had floaters straight after my cataract, and it feels like, those fruit flies are flying. Just
Yeah.
it's quite annoying, actually. I feel it's near my eye, and I keep moving my hands, saying "go away." But it is very funny, though, and it is annoying. You can't do anything about it.
If floaters just come on, then and they're in your line of sight, hopefully after a while, two things will happen. Either they will float below your line of sight, so they'll still be in your eyes, almost like those snow domes which we used to get, which you shake and the snow flies everywhere. So they will be near the bottom of your eye and less noticeable. Sometimes also the brain just blocks them out because they become annoying and they realize that it's not adding to your overall sight. So the brain will just block them out so you don't notice it as much. If you're looking at a bright white background, then you will see them more. And potentially depending on what you're doing. So sometimes they focus more onto your eye when you're looking at something close. Sometimes it could be when you're looking at something further away. So it can be annoying and you can pick them up. Over time, it should become less obvious and potentially, like I said, if it is really annoying, then you can see a consultant about having them removed in some sort of way.
So it can be removed. I thought you couldn't.
You can. Well, there's 2 or 3 things that they can do. First of all, they can use a laser just to maybe obliterate them, make them smaller, or just to cut them out of the way so they fall lower down into your eye. Worst case, which I think is a lot more risky, is to have the vitreous removed from the eye. But normally I've referred a couple of patients to have the laser procedure done so that the floaters are just sort of gently cut away. And that seems to have worked. But again, I think more people probably have those floaters than don't have floaters. So it's not the type of thing which everyone should be rushing for, like a cataract, just to have the floaters taken out. I think most consultants would only really opt for that if it's really causing you a lot of frustration.
Okay.
I know we're sort of reached our 7:30 time, but do you have time, Anand, to go through a few more questions?
Yeah, no problem. It's okay for everyone.
Okay, great. So I'll try to whiz through these. This is a product question. Is it okay to take a MacuShield Original to prevent macular degeneration?
Yes, it is. It depends on what sort of level you have. So let's say, for example, you have early degenerative signs of macular degeneration, then taking something like MacuShield Original can help to sort of boost the health of the tissue there. If you have more advanced macular degeneration, or if you've been diagnosed with macular degeneration, then it's probably better to take something like MacuShield Gold as opposed to MacuShield Original. There are some other tablets as well, which are available. So MacuShield is maybe one brand, and there are other various ones. But generally speaking, if you make sure that there's 2 things to look at. Number one, the amount of lutein, zeaxanthin, and mesozeaxanthin. That's one. And the second thing is the source of where these minerals come from as well. So if you can try and find out where the source of these minerals is coming from, and you can look at the volume or the content, then that will help to decide whether it's good or not. In general, MacuShield Original MacuShield Gold follows the AREDS 2 study, which is the most up to date.
Thank you. So I'm going to bunch a couple of questions up because they relate to dry eyes. One was, what is the test called for dry eyes? Is it
just a dry eye consultation? Unfortunately, doesn't have a very fancy name, but there's different. So I think this was quite a popular question in terms of dry eyes. Effectively, your eyes will become dry because there's not enough tears there, right? And we need to try and work out why that's the case. So is it because the tears are not being produced? Is it because the tears are actually being produced, but they're not staying on your eyes? So you're getting watery eyes and they're just trickling away. Is it because the tears are there, but they're just not effective? So tears actually have three different elements to them. They have like an oily layer on the outside, then they have water in the middle, and then they have a sticky layer on the inside, which helps the tears stick to your eye. So depending on which layer is missing or ineffective, then that can also lead to dry eyes. So in general, with dry eyes, you need to have a dry eye consultation, which will be different from a regular eye examination. And that will help to ascertain what the cause of the dry eyes is, and therefore what can be done to try and manage that.
That's brilliant. I don't know if this is sort of a question. People are using eye drops for dry eyes. Does this sort of progress any cataract issues by taking these drops?
No.
Is there a correlation with that?
No. So dry eye drops in general are not medicated. They're more of a lubricant. So it's more like a moisturizing cream type of solution. Obviously, it's not moisturizing cream, but it's not medicated is what I'm saying. So the drops stay on the outside of the eye and they don't penetrate through into your eyes. So if you're taking glaucoma drops, you'd take them the same way, but that penetrates through into your eyes. The lubricant that you're taking for dry eyes just stays on the outside. So it doesn't cause cataracts. And dry eyes doesn't have anything to do with dry macular degeneration as well. Dry eye simply refers to the fact that your tear performance is not adequate.
Thank you. We've got a hand up from Jag Mora. Jag, do you want to ask your question?
Okay, can you hear me?
Yes.
Yes.
Yeah. Okay. I have glaucoma, and through my regular checks every 6 months, they were identified thickening of epiretinal membrane, and they also identified cataracts. And they say I can go for cataract operation, and during the operation, they could even remove the epiretinal membrane. Is that advisable? Should I go for it?
You need to speak to your consultant about that. A cataract is good, especially if you have glaucoma. Then by removing the cataract, it can, in some cases, help the pressure to reduce. So if you need to have a cataract operation, then yes, definitely go for that. Epiretinal membrane can cause interruption in your vision, and if the consultant feels that it's at the level where they've offered that to you, then I'm assuming that by having that operation, it's probably causing considerable sight loss. And therefore, by removing that, then they would be able to restore more of your sight too. So the epiretinal membrane doesn't have anything to do with the glaucoma or the cataracts, but almost like macular degeneration, it can just reduce your vision by a couple of lines. And I can see the benefit of having that procedure done while they've sort of removed the lens from your eye as well. In a way, it'd probably be easier for them too. So if they've suggested it, then I can only assume that it would help you going forward.
Okay, thank you so much.
So listen, Anand, we've taken up a lot of time, and I sort of want to leave a couple of minutes for closing. But what was interesting to me was your background. You mentioned you spent time in in Africa looking at eye care and helping children there, and you're a specialist in looking at vision for elderly. Can you give some background on that, just so the participants can sort of understand a little bit about you and why they're your areas of specialism and why you're so passionate about eye care in the community?
I think if you look at the eye in general, it's probably one of the smallest organs in the body, but there are whole, not even departments, but whole hospitals dedicated to looking after that. And one of the reasons is because it's a complex structure. A lot of consultants will specialize in, say, the macula or the back of the eye, or the middle of the eye, or the front of the eye, or in your pediatrics, etc. So within ophthalmology, in terms of the eye consultants, you have that specialism. And I think with optometrists too, there's a lot of optometrists who start working in practice, and depending on what the patients that you're seeing or the interest that you have, we have the same type of specialism as well. So some optometrists may enjoy fitting contact lenses, for example, and they will fit contact lenses to irregular eyes or complex eyes. Some may specialize in working with children. Some have that interest in working with the elderly. So I think in terms of where I've worked, we provide a visiting service, and we also a home visiting service, sorry, and we also have the high street practice as well. So we see a lot of patients. Between Maya, my wife, is an optometrist as well. We work together. So between us, we have a lot of patients who are very young, and we have a large myopia management clinic within our practice. I also see patients who have learning disabilities as well, or learning difficulties. And I think that is just an experience thing in terms of how to deal and help support patients who have different eye needs, but also different challenges in terms of communication too. So you need to be a little bit more flexible in terms of dealing with that. Sports vision as well. So if we take any task, reading is probably the most complex task for your eye to be able to carry out. And similarly, if you're a sports professional or a sports athlete, 1 second or 2 seconds can, make a world of difference to your game. So just making sure that your eyes are on top performance for that task that you're carrying out, or if you're playing golf, that you're aiming for the middle of the pot and not way off, that sort of thing. So likewise, there's lots of different specialties. So in terms of where I've worked within hospital optometry, I've worked in the low vision department, so seeing people with sight loss, and then with the home visits that we provide as well, to see a large number of elderly patients, and I've been able to support them. So it's just developed in terms of having the clinics for the children, the support throughout life in terms of sports, learning difficulties, learning disabilities as well, and then elderly and the changes. And we have a good low vision clinic as well at the practice too. But I think what has given me the interest or the motivation is probably the medical camps that Maya and I have both been a part of as well. So since I qualified, actually, I was able to join the medical camps organized by the SAI organization, under the lead of Dr. Upadhyay, who I'm sure many of our guests would have probably heard of. And it opens your eyes to what we have here, like I mentioned before, but also how we can adapt ourselves to offering each individual patient the best care, wherever they are, whatever the resources are as well. So when we visit different countries and we see what they are struggling with and what the provision is there, and we try and adapt ourselves just to offer them more as well. And actually that was the reason why I started the home visits as well. It's because on one medical camp in Russia, I was asked to see somebody at home, and I thought Dr. Upadhyay was going a bit crazy. I thought, really, we'll just wait for the lady to come in to see us. And I realized when I went there how much of the need there was. And I realized that if there's a need in Russia, then there must be a need in Harrow and in London. and hence it came from there. So I think with optometry, with the experience, with your interests, it grows. So when you visit your optometrist, I'm pretty sure that all optometrists have some sort of specialist keen interest area which they like to follow and they like to try and develop themselves on.
Well, that's brilliant. What a great
Anna,
story.
can I quickly ask something? I did put a question inside. No?
I'm sorry, we have another call in 2 minutes. So I
Okay, but
really
is
have
there a
to,
contact number for Anand? Then I can ask him personally.
yeah,
Thank you.
I will share his number.
Thank you.
Sorry about it. Sorry,
Sorry.
Saroj and
Thank you. It's
Mayuri.
okay.
Sorry. So, Anand, on behalf of GAA London, we sincerely thank you as our speaker and for sharing your expertise and giving us such valuable insights into caring for our eyes and protecting our vision. Today, we've learned quite a lot about common eye conditions, prevention strategies, and the importance of regular eye checkups. Knowledge that can only and truly make a difference in our everyday lives. A heartfelt thank you to each of you who joined us this evening, and your participation and questions made this sessions interactive and meaningful. So let's remember our eyes are precious and caring for them is a lifelong investment in our health and well-being. So we look forward to welcoming you to our next community health session. Until then, stay well, stay positive, and take care of your visions. Thank you, Anand, and thank you all the participants who joined in today. Thank you, Kamlesh, and we shall say Shubharatri and good night. Thank you all.